This figure gives a complete overview of immunosuppressive drugs, their classification, mechanisms, clinical uses, and adverse effects. These medications are primarily used to prevent organ transplant rejection and treat autoimmune diseases such as rheumatoid arthritis, systemic lupus erythematosus, psoriasis, and Crohn's disease. Let's walk through each section of the diagram step by step. Now, understanding immunosuppressive drugs. Main clinical purpose. Immunosuppressive drugs are used to 1. Prevent organ transplant rejection, 2. Treat autoimmune diseases, including rheumatoid arthritis, systemic lupus erythematosus, SLE, psoriasis, other immune-mediated disorders. These drugs work by suppressing different parts of the immune system, particularly T cells, B cells, and inflammatory cytokines. Number 1. Glucocorticoids, examples, methylprednisolone, dexamethasone, prednisone. Mechanism of action. Glucocorticoids act at the gene transcription level inside immune cells. Key actions. Suppress transcription of pro-inflammatory cytokines. Most importantly, decrease IL-2 production. Because IL-2 is required for T-cell activation, lowering IL-2 strongly suppresses the immune response. Immunologic effects. They reduce T-cell activation, B-cell activation, macrophage activity, inflammatory responses. Clinical uses. Prevent transplant rejection, treat autoimmune diseases, treat severe allergic reactions. Major adverse effects: hyperglycemia, osteoporosis, hypertension, immunosuppression, higher infection risk. Number 2, cytostatic agents, antimetabolites. These drugs suppress immune responses by blocking DNA synthesis in rapidly dividing immune cells. 2 important drugs highlighted. Methotrexate. Mechanism. Methotrexate inhibits dihydrofolate reductase, DHFR. This blocks conversion of dihydrofolate tetrahydrofolate. Without tetrahydrofolate, DNA synthesis decreases. Rapidly dividing immune cells cannot proliferate. Result: immune cell proliferation. Clinical uses: rheumatoid arthritis, psoriasis, cancer chemotherapy. Important teaching tip: methotrexate is given once weekly. To reduce toxicity, folic acid, leucovorin rescue is given 24 hours later. Adverse effects: bone marrow suppression, hepatotoxicity, oral ulcers, stomatitis. Cyclophosphamide. Mechanism. Cyclophosphamide is an alkylating agent. It works by creating DNA crosslinks, preventing DNA replication. This kills rapidly dividing cells, including immune cells. Uses: cancer therapy, severe autoimmune diseases, transplant rejection. Adverse effects: myelosuppression, hemorrhagic cystitis, infertility. Hemorrhagic cystitis occurs due to acrolein metabolite toxicity in the bladder. Number 3, calcineurin inhibitors. These drugs prevent T-cell activation by blocking IL-2 production. Mechanism pathway. Normal pathway: T-cell receptor activation, calcineurin activation, IL-2 gene transcription, T-cell proliferation. Calcineurin inhibitors block this pathway by inhibiting calcineurin, which prevents IL-2 production. Cyclosporine. Mechanism. Cyclosporine binds to cyclophosphamide. The complex inhibits calcineurin. Result: IL-2 production, T-cell activation. Clinical uses: organ transplantation, autoimmune diseases. Adverse effects: major toxicities include nephrotoxicity, hypertension, hyperglycemia, hyperlipidemia, hirsutism, gingival hyperplasia, Hashim mnemonic. Cyclosporine makes everything increase: increased BP, lipids, hair growth, etc. Tacrolimus, FK506. Mechanism: tacrolimus binds FKBP, FK binding protein. The complex inhibits calcineurin. Result: IL-2 production, T-cell activation. Tacrolimus is 10 to 100 times more potent than cyclosporine. Adverse effects: nephrotoxicity, neurotoxicity, hyperglycemia. Number 4, monoclonal antibodies. These are highly specific biologic drugs that target specific immune receptors or cytokines. Muramonab CD3, target CD3 receptor on T cells. Effect: rapid T-cell suppression. Clinical use: acute transplant rejection, rituximab. Target: CD20 receptor on B cells. Effect: destroys B cells. Clinical uses: non-Hodgkin lymphoma, rheumatoid arthritis, autoimmune diseases. TNF-α inhibitors examples: infliximab, adalimumab. Mechanism. These drugs block TNF-α, a key inflammatory cytokine. Blocking TNF-α results in IL-1, IL-6, inflammation. Clinical uses: rheumatoid arthritis, Crohn's disease, psoriasis. Key concept summary: immunosuppressive drugs act at different levels of the immune response. Drug class: main target, result. Glucocorticoids: cytokine gene transcription. inflammation, antimetabolites, DNA synthesis, immune cell proliferation, calcineurin inhibitors, IL-2 production, T-cell activation, monoclonal antibodies, specific immune receptors, targeted immune suppression. Big picture, all these drugs ultimately reduce immune system activity, which helps prevent transplant rejection and control autoimmune diseases, but they also increase the risk of infection and other systemic side effects.